Another study that flew under the radar a little bit at GI ASCO that I think was really worth paying attention to is the ALASCCA study. We've known in colorectal cancer for a while, there's old data on this, that giving people aspirin after their surgery in the stage 2 and stage 3 setting might lower their risk of recurrence. This has been seen in patients with mismatch repair deficiency with Lynch syndrome, but it hasn't really been tested in a setting where we're actually using another biomarker, such as a genetic mutation, to see if this specific population benefits from doing aspirin. So what these researchers did is they looked at patients with rectal and colon cancer that were resected, and they specifically selected people that had a PIK3CA mutation. There were two different arms. There was the main arm, which had PIK3CA exon 9 or 20 mutation, and then there was a second arm that had other mutations in this pathway. And each arm independently was randomized to just regular observation with a placebo after resection and standard of care treatment versus giving the patients aspirin. And they were given 160 milligrams of aspirin, which is a little bit higher than a baby aspirin, but it's not super, super high dose aspirin. And what these researchers looked at is, in each arm, they wanted to see whether giving people aspirin reduced the cumulative incidence of recurrence, meaning does this help prevent people's cancer from coming back? One of the really exciting findings from the study was that the cumulative incidence in people that took aspirin versus a control after they received standard of care therapy for their early stage colorectal cancer, the cumulative incidence was halved in patients that took aspirin. The 3-year cumulative incidence percent was only about 7.5% in patients that took aspirin versus 14% of people at 3 years in patients who were in the control. This is pretty amazing. This actually could be practice changing. And again, these patients all had PIK3CA mutations. There's a hypothesis that because of the way PIK3CA works, it involves metabolism, glycolysis, and aspirin might have an increased benefit in the subpopulation. The adverse events were also pretty reassuring in this group. I think this is really something to keep your eye on. And in patients that have stage 2 and stage 3 colorectal cancer, you should probably get genomics on these people. And if they have a PIK3CA mutation, I would put them on aspirin. There's always risk of bleeding. There's other risks to aspirin that can cause gastritis. But I think in this select group of people, this data is really provocative that it might help prevent recurrence.